AC joint, the acromioclavicular joint. That is the site of the separated shoulder. So you hear someone say, I separated my shoulder, they're at the acromioclavicular, not the glenohumeral. All right, so we're back here on the acromion section. So for a posterior palpation, back to acromion, and now we're going to just work our way. You're going to feel a nice bony ridge as we move posterior. This is the spine of the scapulae. Katie's going to be following us. That should be the blue line. Okay? That spine of the scapulae should come all the way, and then it's going to terminate right here on what we call the medial border. You guys can kind of see that outline right here. Agreed? Sometimes called the vertebral border because it's near the vertebrae. Okay, so this is the medial border of the scapulae. Comes down, makes a little turn right here. That's the inferior angle. We follow it all the way up, makes a slight turn way up here. That's the superior angle. So her scapulae really is this long. Okay? That's how long her scapula is. This is levator scapula. Hey, levator scapula, how you doing? The muscle up there. Right? That's your medial border. As we come on down, we can actually work the lateral border. And yes, the lateral border is going to work its way all the way up into the axillary. Okay? And way up here, right up there, you're going to maybe feel a little bump. That's the infraglenoid tubercle. Glenoid, shoulder, tubercle, little bump. It's the insertion or the origin of one of your tricep heads. You have 3 tricep heads. Comes like that. All right? So on this side, so you guys can see, same thing. Coming down, inferior angle, work that lateral border all the way up in there is the infraglenoid tubercle. All right? You're way up in that area right there. All right? Questions so far? What we can do, if we want to help with our visualization, is the patient can actually assist us. If we ask her to chicken wing herself and relax, you can see that the scapulae will fall off the thorax, which makes it even more easy. So you actually now visually see that medial border. You actually see the inferior angle. You can even come around. I can actually get right in there, and that's her scapula, just kind of grabbing her scapulae. It looks like basically an upside down, or actually, it's like a tortilla chip or a Dorito, right? So it has a beautiful shape to it. Questions so far? All right. So those are all the main landmarks. We can actually get her back to relax. Advance to one side, please. We also have our fossa, or fossas, all right? We go back to our spinous scapulae, and we roll our fingers up in here. This is the supraspinatus fossa. What muscle is in the supraspinatus fossa? Supraspinatus. Real original there, huh? Back to the spine, we drop down here in the infraspinatus fossa. What muscle? Infraspinatus. Again, really original here, huh? And then we chicken wing her gently. We can come up and go right underneath into the subscapular fossa. What muscle?
Subscapularis.
Subscapularis. And yes, I want you to get right up, and you can get right up underneath her scapulae. This feels awesome, okay? If you have an overhead athlete, or you do CrossFit, or even you're doing a lot of arm work, and you get someone to give you a subscapular release, your shoulder and arm will feel like $1 gazillion, and that is a real amount, all right? It's so many adhesions through latissimus dorsi, trapezius, and your rotator cuff. You can kind of get way up in there and just, like look at that, I can move her whole shoulder off her thorax. How's it feel? Yeah, it feels great. I know it looks kind of funky because I'm like, but it feels fantastic, okay? But you can get right underneath and get to subscapular, all right? And just bring them back and have them relax. Questions on your posterior? All right. When we get doing some of these muscles, I'm going to walk you through some of the actions so you actually can feel the muscle contract just like we did like gluteus maximus and the hamstrings. Fair enough? All right, so let's do some posterior palpations. Because they're blind palpations, good communication, please. Go.